Hi, my name is Katalina Jones, and I am 19 years old. I live in Staten Island, New York, and a lot of you may know, and a lot of you don't know. I am battling Sickle Cell Anemia. If you don't know what that is, you could just Google it, and I live in a hospital. I go to the emergency room about 4 times a week, and it's really offensive to me that there's only 2 hospitals out here, and neither one of them want to help me. They push me off, they kick me out, and they just, call me random names. It's really offensive that they call me a drug addict and a drug seeker. And, I know a lot of you have seen videos of me. And, that's when I was like 16, 17 years old. That's when I was a wild child, sorry. But I grew up now. And I know that a lot of you have seen scars on me. Like right here and right here. That's from having tubes in my neck. I've also had my gallbladder removed and liver biopsies and transcranial Dopplers and a whole field of tests because of my illness. And the tubes in my neck is called a Metaport. It's easy access for them to the blood rather than stick me in my arm, like normal people. They just stick a metal needle right in my chest so they could give me fluids and all the pain medicine and, things that could make me feel better. But now it's even harder for me to try to feel better because of the hospitals. They don't want to take care of me. All they want to do is give me Motrin or Tylenol or Toradol. Toradol does nothing for us sickle cell kids or teens or adults. It's like water. And Motrin, that does nothing. Tylenol, over-the-counter Tylenol, it does nothing. Like, come on. I'm tired of being discriminated because I'm in pain and they want to feel like I'm fine, but they don't know me. They don't know me. They just see me because I go to the hospital often. That doesn't make me a drug seeker, a drug addict, or anything. And now I have to just take 2.5-hour trips just to go to Columbia Presbyterian Hospital to try to get pain management. That's what it's called. To have the doctors take better care of me than these hospitals out here. And it's like I'm in pain while making a 2.5-hour trip up there to Manhattan, while I could just, be in an ambulance and be in a 10-minute ride to go to the emergency room and get seen quicker. I'm just so fed up being discriminated because I have sickle cell and I'm in pain. I can't help it. I didn't choose to be born this way. I didn't ask to be stuck with this illness. They say that I could get a bone marrow transplant, but, I don't know. My mom is not a match. My sister, my brother, my dad. I don't have no one who's a match for me. It's kind of hard because I'm scared that I'm going to be stuck with this forever. I don't want to be stuck with this forever. I just want help. That's all. That's all I ask for is help. I ask the doctors for help. While I'm sitting, crying, waiting for pain medicine, waiting to be seen by the doctors. You know, some of the doctors are nice there at St. Vincent's Hospital, but now it's called Rumsey, Richmond University Medical Center, here in Staten Island, New York. You know, even, ooh, even one doctor had the nerve to put his hands on me physically. He was trying to he grabbed my arm really hard, trying to take out my IV in my hand. You know, he could have just said, "May I have your hand, please, so I could take out your IV?" I would have gave him my hand. But he's sitting there grabbing my arm really hard, forcing me. That's not a really doctor way to do things. I don't know who made him a doctor, but that's just wrong. Especially with me being weak and in pain and struggling each and every day to survive, to be normal. It's hard for me to be normal. I'm in the house every day. I'm homeschooled. I'm alone. I have no one in my corner except for my mother. You know, people say that's all I need. But I need friends too, real friends. Real friends who would love me. You know, love me for me. Be there for me. I'm really tired of this. You know, to all my other sickle cell people out there, I hope you do see this. Because my life is like not worth living anymore. Because I get discriminated. I get hated. I get, names. I get labeled. That's what it is. I get labeled. I'm not like every other drug addict out here. I'm not even that. I'm just a young lady in pain, struggling for people to like me, struggling to be normal, struggling to be something that I'm not. I know what I was born with, and I know who I am. And, if you're gonna love me for me, please do. I will stand by your side each and every day. If you need me, I'll be there. If you call me, I'll answer. If you even come to hang out with me, we'll have the best of times. But, this is me. And if you're gonna love me for me, I'll be there for you. I just hope that I could find a match. That way I could be cured from this sickle cell. It's even so bad for me that not even Percocet, Tylenol with codeine, morphine, what else? Percocet without the Tylenol in it, and that's strong. Or Vicodin, that doesn't even help. Now I get the strongest thing out there in the emergency room. It's called hydromorphone, aka Dilaudid. And I'm 19 years old, getting the strongest medicine that they have. It's not good for my body, but it helps. I see people falling asleep when they get morphine or Dilaudid. But me, I am awake. It doesn't even put me to sleep anymore. It's like my body is getting so used to it now. So what am I going to have when my immune system is used to the Dilaudid? I'm not going to have nothing. Sooner or later, I'm going to be having nothing to take that will actually work, that I will suffer in bed right now like I am now. I'm in pain. And what am I gonna do? Who knows? But as I said, I just want help. I want help finding a bone marrow donor. This is ridiculous. And I'm just getting sick and tired of my illness. My life sucks. Thank you for watching. I hope you enjoyed watching this video. Once again, my name is Katalina Jones, and I'm from Staten Island, New York. Who knows what. Bye.